and welcome to For Your Health. I'm Mark Crosby of Quincy Access Television. Thank you for joining us for this particular program. It's a program that basically helps you to stay informed and, of course, stay healthy. Joining me from the Quincy Health Department is public health nurse Caitlin Pico. Caitlin, welcome back.
Thank you, and as always, thank you for having me.
Great to have you. Always a lot of great information that you share when you come into the QATV studios. And we should mention that this program does get picked up by several access centers really nationwide. So we are proud of that. Certainly we thank those access centers for running programs like these. Today we have something that is very timely. We have hit the spring here in the Northeast, and we are going to unfortunately talk about, or fortunately talk about, ticks. I'd say unfortunately they exist.
Of course, yes. I was telling you, even doing this research, looking at all the pictures of the ticks makes my skin crawl a little bit, but we're definitely going to review some facts about them, briefly go over the diseases they can cause, and of course, the most important, prevention.
Absolutely. We do these programs for that being the primary purpose, prevention. If we can prevent someone from getting ill, that's of course the main goal.
Yes, the best measure.
So we will take a look at the outline so folks at home can follow. So for you, this is what we will be talking about, as Caitlin mentioned. First, we will talk about ticks. We will talk about the types of ticks, specifically here in Massachusetts, common symptoms of tick-borne diseases, diagnosis of tick-borne diseases, prevention tips, and then surveillance and additional information. So about ticks.
Yes, so many people may know this, but ticks are tiny bugs. They kind of look like a little beetle in some cases, and they're often found in shady, damp, brushy, wooded areas, especially if there's high grass. So you want to make sure you're not coming into contact with these. It's important to know that ticks do not jump or fly. They attach to the host if they come into direct contact. And ticks are very dangerous because they can be infected with bacteria, viruses, and parasites, all which cause some pretty severe diseases in humans and animals alike. And then in Massachusetts, bite ticks can spread diseases such as Lyme disease, which is the most common, babesiosis, anaplasmosis, tularemia, Rocky Mountain spotted fever, Borrelia miyamotoi, and then the last one is Powassan virus. And forgive me if I mispronounce any of these.
Well, I'm going back to actually Lyme disease, which I know I can pronounce, and so can you. The other ones I'll leave alone right now. But just to signal or single that one out, I had Lyme disease. I was bitten by a tick, and I didn't know it because, of course, they're small, like you had mentioned, and they're hard to locate. But it was maybe a couple weeks later I realized something was wrong. I had Bell's palsy, so half my face was paralyzed.
Yes, and that can be very common, and a lot of times, as you said, people don't know about the bite, so when those symptoms develop, they're not sure a lot of times what caused it. So in our prevention, we'll say number one would be daily checks, so that way if you had realized you were bitten by a tick, which not always can be determined, you could kind of just look out for those symptoms and contact your healthcare provider right away for treatment.
Well, next, as I had forecasted, we will be talking about ticks that are common in Massachusetts.
Yes, so there are 3 ticks that are most common here in Massachusetts. So first we have the black-legged ticks, otherwise known as deer ticks. These spread, again, Lyme disease, babesiosis, anaplasmosis, the Borrelia miyamotoi, and then the Powassan disease. Highest risk during spring, summer, and fall, but you want to know these can be year-round, especially if there's no frost on the ground, and they may still be active. So you just want to make sure you're being careful. And with this type of tick, both the young and the adults both bite. So it's really hard to see this sometimes because the young ones can be as small as a poppy seed. So you really want to make sure you're looking for anything that could even look like a new freckle because it could be a tick.
And I suppose maybe you might be able to feel the bump, maybe?
Sometimes you can, but if you see a new tick and you were just out or a new freckle, apologize, and you're out in the woods, you may want to contact a healthcare provider or someone to just take a look at it to make sure it's not a tick.
And does it always, I guess maybe we'll talk about this in symptoms, but do you always get the bullseye rash?
Not always. So it depends, and with any symptoms and any diseases, it can be different for all individuals. So you don't always see the rash, but there are common symptoms that you see with a lot of these different diseases. So you want to make sure if any of those develop, you do contact your doctor.
Okay, I jumped ahead, but that's me. We'll get there. Let's talk about Lyme disease.
Yes. So Lyme disease is the most common vector-borne disease in the United States. And when I say vector-borne, that is a disease that's caused by a bite. So you most often will see that with ticks and also mosquitoes. And if this is left untreated, the infection can spread to the joints, heart, and your nervous system. So you want to make sure if you develop symptoms and you were just outside, that you contact your healthcare professional because this can be treated with a few weeks of antibiotics.
And next, I'll have you pronounce this one.
The babesiosis. So this is another disease which is caused by a parasite that affects the red blood cells. This also does have effective treatment. And a lot of times with this, if people may remain asymptomatic and go without knowing, in that case, they wouldn't be treated. A lot of times you would only be treated if you were symptomatic.
And next?
Anaplasmosis is next, and this is also caused by a bacteria. And the biggest thing with this is doxycycline is the drug of choice to treat that.
And don't you love this? I just keep on handing these off to you because I'm afraid of the pronunciation.
That's okay. I wrote it down, so hopefully I am saying it correctly. So the Borrelia miyamotoi is caused by a spiral-shaped bacteria that is distantly related to the Lyme disease bacteria. So that is kind of looked at closely. It's closely related to Lyme disease.
And I can do this one, Powassan virus.
Yes. And then this is still rare, but the number of cases in the U.S. has been increasing in recent years. There currently is no vaccine or known treatment, so the best thing at this time is prevention.
And just out of curiosity, how long does a tick need to be on you to actually do damage?
So I unfortunately do not know the exact timing, but it is important to say, I'll get to this later on too, tick testing, say you were to be bitten and you take that tick to be tested, the state won't test them because even if that tick tests positive for a disease, it doesn't say specifically they transferred it to the individual. And not all ticks do have these bacteria, of course. So it's really, if you believe there's a tick bite, you could save it for examination just so your provider could see what it looked like. But for the most part, it would be based on symptoms and based on what, if you had that exposure.
Right, I guess bottom line is that you should really be checking yourself.
Yes, yes.
And that, again, is part of prevention, and we will get to prevention.
Yes.
Let's talk about dog ticks.
Yes, so this is the second type that we find in Massachusetts.
Absolutely.
So dog ticks, they spread the Rocky Mountain spotted fever and certain types of tularemia. I apologize if I mispronounced that.
I'm not going to catch you on that.
Yeah.
I won't know the difference.
The highest risk would be spring and summer for this, and adult-sized ticks are normally the size of like a watermelon seed.
Oh, okay. So those are easy to spot.
Yeah, so these are a lot easier. I would say the deer ticks are probably the hardest to identify because if it's the size of a poppy seed, it's really hard to tell.
Absolutely. Rocky Mountain spotted fever.
Yeah, so this is also a bacterial disease, and it can be deadly if it's not treated right away with the correct antibiotic. So again, if you develop symptoms, go see a doctor so they can rule everything out. And then the last one, the tularemia, is also caused by a bacteria, and it's found in small rodents or mammals like rodents and rabbits, and also ticks. These symptoms can vary, but this can also be life-threatening.
Now, Lone Star ticks, I would think this has to do with the Lone Star State.
So that I am not sure.
But these are ticks in Massachusetts.
Yes,
right?
they are
so
ticks.
That's impossible.
So at this time, they're not a significant source of illness in Massachusetts, so it's very low risk. But these will spread the tularemia, ecclerosis, and southern tick-associated rash illness. So this rash, they believe it's because of the tick saliva that's causing an irritated section. So where they bite, this is where you would see the rash around the section. If you get this rash, it doesn't necessarily mean you've been infected, but you would definitely want to follow up from a doctor.
I'm glad you said a doctor, because if you go onto the internet and try to self-diagnose, you could be in trouble.
Of course, that's one thing we will never recommend is self-diagnosing. I always recommend seeing a healthcare professional. And it's important to know with these ticks, both the young and adult females are the ones most likely to bite.
And next?
So then I just have the auriculosis, which is another bacteria. Doxycycline is also the drug of choice for treatment. And then the southern tick-associated rash illness. It's similar to the rash of Lyme disease. And it can be found on humans following the bite from the Lone Star tick. And this rash may be accompanied by fatigue, fever, headache, muscle and joint pain. The exact cause is not known why this rash happens, but they believe it is because of the saliva of the tick.
Interesting. Red meat allergy.
Yes, so that's another very interesting thing about the Lone Star tick. So it can cause a red meat allergy in individuals. It's also known as the alpha-gal syndrome, and it is serious and potentially life-threatening. Because it's an allergic reaction, so it affects all of your body systems. Alpha-gal is a sugar molecule found in most mammals, such as pork, beef, rabbit, lamb, and milk products. Symptoms would be similar to any anaphylactic reaction. The individual may experience rash and hives, nausea, vomiting, diarrhea, shortness of breath, cough, drop in blood pressure, swelling of the lips, throat, tongue, and eyelids, which is always a medical emergency, dizziness, and severe stomach pain. So these symptoms can occur 2 to 6 hours after ingesting the meat. Always call 911 if this happens. It may not always be the severe reaction for yourself, but if you had a tick bite and you eat meat and you start to feel really sick, make sure even if it's not the anaphylactic reaction, make sure to talk to your doctor to make sure it doesn't exacerbate into that.
As we're doing this program, I'm thinking, gee, there's a lot to worry about.
Yes.
Absolutely.
Yes. Especially where we love hiking so much.
I know, you and I love to hike. I'm not too sure now. I think I'm done hiking. common symptoms, now we're getting into the symptoms of a tick bite.
Yeah, so as you can see, there are a lot of different diseases that can be spread by ticks, but the majority of them have similar symptoms to look out for. So as I keep repeating, I feel if you were to get bitten and you develop these symptoms within 2 weeks, call your doctor. These symptoms may include body or muscle aches, fever and chill, headaches, fatigue, joint pain, rash, stiff neck, and then facial paralysis, as you had mentioned before. So this is thought to be caused by the toxin in the saliva of the attached tick. People with tick paralysis can experience weakness or paralysis that gradually moves up the body. These symptoms can sometimes resemble other neurological conditions such as the Guillain-Barré syndrome. But people do typically regain all of their movement within 24 hours after removing the tick.
Yeah, and back when I got bitten, I had no symptoms, and it wasn't, maybe it was 2 weeks later or thereabouts, I developed the paralysis. And
Yes.
at that point, I did seek medical attention and was given an antibiotic.
Yes, which can be terrifying, especially where you didn't even know you had a tick exposure. So it is a very scary incident. And of course, any paralysis, you would be calling 911 regardless of what caused that, because you always want to make sure you're checking up.
Absolutely. So let's talk about diagnosing a tick bite.
Yes. So I really just briefly am generalizing here, but a diagnosis for a vector-borne disease is based on your symptoms, the physical findings, for example, a rash, and then also the possibility of exposure to infected ticks. So a lot of times an individual would follow up with their doctor, and once lab work is completed, your lab result, if it were to be positive, is sent to your local board of health, where that health agent or public health nurse calls you to do an investigation. So if someone in your city were to be diagnosed, the local board of health would call you and ask you all questions about where you traveled, have you been outdoors, any known tick bites. So it is very interesting, and your local board of health, if there's questions, you can call them, because this is what we do.
Prevention, again, is very important in the programs that we, in the topics that we cover on the programs that we do. So let's talk about protecting yourself. Obviously, I'm thinking covering yourself, number one, probably.
Yes, yes. Well, so number one actually would be check yourself daily, which you had mentioned earlier. But you also want to make sure you're not just checking yourself, make sure you're checking your children and your pets, especially if they're outdoors all day. You want to make sure giving them a good check.
Right, because I'm also thinking that your dog or your cat might come in the house with the tick, lay next to you, and possibly even transfer the tick to you.
Yes, if the tick were to fall off, and then it could come onto the human, because it would be a new host at that point. So it's important to know that ticks' favorite places on the body are between your toes, the back of your knees, groin, armpits, neck, along your hairline, which you would see would be difficult with animals, and
or
also
even
behind.
with me.
Yes,
Or
yes.
you.
I was saying I had to check behind my ears a little better with all my hair back here. But they can be very small, so you want to be looking for a new freckle even, because as we said, they could be the size of a poppy seed.
Remove any attached ticks as soon as possible.
Yes, so you want to make sure you're removing the tick if you find that.
And sometimes they're very difficult to remove, are they not?
Yes, they can be difficult. If it were to get to a point where you cannot get it out, I would call your doctor and have a professional take it out.
Because they kind of burrow.
They can't, yes, they burrow in your skin. So the best way they say to remove it is to take a pair of tweezers and go as close to the skin as possible without damaging your skin, and pull up with a good amount of force to rip it right out. It's very important to say avoid remedies such as kerosene, petroleum jelly, nail polish, or a hot match. These measures are not effective and it can result in injury.
Clearly, kerosene and a hot match, you could end up burning yourself. So,
Yes.
Yes, and the tick could still be there.
Yes, because
Right.
I always heard the petroleum jelly is to put it to suffocate it,
Yeah.
but it's not known to be effective. So I would say stick to what we know works, and hopefully that would cause the least amount of injury.
Note the date of potential exposure and removal.
Yeah, so that's important, especially where the incubation period, you might not get symptoms for 2 weeks after.
That's tricky.
It is very tricky. And at that point, if you look back, what did you eat 2 days ago for lunch? Your memory kind of blurs. So if
Mine
you,
definitely does, actually,
Yeah.
2 hours ago.
Yeah.
What I did 2 hours ago is gone.
So I agree with you. I'm the same way, unfortunately. So I would say make sure you're noting that. If you have a calendar, maybe put a note in your phone the day that you went on a hike, the day
Well,
that
that would be easy. That's relatively
Yeah.
easy to do.
where you went on the hike, and then also the location where you removed the tick would be important. I also had the save the tick for identification, but that is a little hard. I know people have come to the health department.
This isn't a campaign to save the tick, right?
Yeah.
No.
Yeah, the tick's not going to live through this, and it's really hard to diagnose based on that. We wouldn't be testing
Right.
the tick itself.
Right. And again, it really comes down to really these prevention tips to, again, make sure that you're covered, make sure that you check yourself.
Yes.
Checking yourself is number one. And this, for not only for what we're discussing here today, but prevention on any of the programs, like I had mentioned in the
Yes.
in the past, or at least at the beginning of this program, that's really the strong point of all these shows.
Yes, and that is why we review all this information. It is to prevent this from happening to yourself, of course.
So notifying your healthcare professional, especially if you develop symptoms.
Yeah, so if you develop those symptoms, you may have the rash around the bite area, fever, headache, fatigue, sore muscles, or aching. And then also consult with your vet to make sure that your pet is protected. I didn't have all the research there for the pets, but you always want to make sure they're safe too, because they're family members as well.
Absolutely.
Take care of them.
They certainly are. I have a rabbit and a bird. They're family
Yes.
members.
Yes, they are.
Prevent ticks biting you outdoors.
Yeah, so this is more, if you were to go hiking, you want to make sure you're sticking to the paths, because when you're in the woods, if you start to walk through the brush, which you shouldn't do anyway if there are clear paths, save the forest. You want to make sure you're not walking through the wooded areas, because that's where the ticks may be, on the tall grass and all the brush on the ground.
And it takes nothing for them to kind of transfer from that
Yes.
blade of grass to you.
If they have a direct contact, they will come right onto you. Another thing would be wear light covered, long sleeve shirts, long pants. And you also, if you're hiking, want to tuck your pants into your socks just to give them less bare skin to grip onto.
Yeah, don't worry about fashion, folks.
Yes, and then I also say the light clothing, and that's to better identify them, because if you're wearing black pants, you're not going to see a tick on them.
Absolutely. Using bug repellents.
Yes, so this is another very important thing. You always want to make sure you have repellent on if you are going into the woods or be outdoor for a long extended time. So most of the ingredients will have DEET in it, and this can be used directly on your skin, but you want to make sure you're following the directions on the product, simply because how much an adult can have versus an infant is completely different. So you want to make sure if you are using any of these on your child, you are using like a child version to make sure you're not overdosing, because you want to, anything that's on the skin, your skin will be absorbing. So follow those instructions. And the other kind of repellent on the market will be containing permethrin. So this kind of repellent can be used on your clothes. You see this a lot of time with camping. You may spray your tent, but permethrin cannot be sprayed directly on the skin. So again, make sure you are following those instructions before you're spraying it on yourself or family members.
We should, and I think a lot of people forget this, but the skin is the largest
organ, yes.
Right.
So anything your skin is absorbing, of course, anything it comes into contact with, especially if it's for a long duration. So of course, these are regulated and they make sure they're safe for individuals to use, but anything like this, follow the guidelines because you don't want to overdose yourself with a bug spray.
I know there are natural remedies out there. I don't know how effective they are.
Yes, so there are natural. I would just, I personally stick with what is like approved by the FDA and all of that. Just make sure you're doing your research before you use a product.
And surveillance and additional information. There are some websites available.
Yes, so all of this information I have obtained from the CDC and from the Massachusetts Department of Public Health websites. And it's important to know that these different sites, they are the CDC, the National Center for Emerging and Zoonotic Infectious Diseases, along with the Division of Vector-Borne Diseases, do track this information. They are collecting data, especially like at myself, if somebody in the city were to be diagnosed, I would collect the data of where they traveled, what symptoms they had. So if you wanted additional information on any of this, or you wanted to track your areas to see how active they are around your community, definitely go to either the CDC website, which is just cdc.gov, or the mass.gov website, and both of those are great resources.
Folks, just be aware when you're out there.
Be aware. That's the main thing. You want to still live your life. I will never give up hiking myself.
I seriously won't.
As long as my body can do it, I'm going to keep going. I just got to make sure you're being smart about it. You're checking for ticks, you're using your repellents, you're wearing the light clothing. Just want to prevent disease.
I think, I don't know if this is true, and I'm not asking you to verify it, but I heard ticks, I heard chickens like to eat ticks, but that might be the only animal that really eats ticks.
Yeah, I'm actually not too sure about that. I'd have to do a little research myself.
I'm not totally certain. I heard that somewhere. Hopefully it wasn't in a dream. Hopefully it has some reality to it. I don't know. Anyway, thank you so much for coming in and talking about ticks on this particular episode.
Of course. And again, any information, you can look at those websites or call your local Board of Health, because this is what we do.
Great. Well, thank you. I might go out now and buy myself a chicken. No, I'm kidding. I want to, again, thank you for coming in, and I'm going to thank you at home for watching. Please continue to watch programs like this, and these programs are possible with support to your local access television station. Take care.